Look at your feet right now. Not a quick glance. Really look at them. Because what you see or don't see on your feet at this moment can tell you something very precise about an organ you could never see directly. An organ that is working for you every second of every day, silently, without complaining, very often until it is too late. I'm talking about your liver. The connection between your feet and your liver is not intuitive. It is not obvious. And that is exactly why almost nobody knows about it, and almost no doctor stops to explain it during a routine appointment. I'm Dr. Nova Blake, and I've been practicing medicine for over 30 years. Today I'm going to show you 7 signals that your feet and lower legs send when your liver is struggling. Signals you can observe right now, without any instrument, without any lab test, just by looking. Stay with me until the end, because the last signal is the one that surprises my patients the most, and the one that most often leads to discovering a liver problem nobody suspected. Before we begin, the essential disclaimer. This video is educational. The signals I will describe are not a diagnosis. They are indicators that deserve a conversation with your doctor and the appropriate tests. Not self-diagnosis, not panic. An informed conversation. With that said, let's understand why your feet reveal the story of your liver. Why your feet reveal your liver. The liver and the feet seem to be at opposite ends of the human body, and in a sense they are. The feet are the point farthest from the heart. Blood must travel the maximum distance to reach them and return. This is exactly why circulatory problems and many liver problems manifest with circulatory problems appear first and most clearly in the feet and lower legs. Think of the vascular system as a hydraulic system. If the central pump, the heart, is strong, and the tubes, the arteries and veins are in good condition, fluid reaches everywhere with adequate pressure. But if pressure drops, if the tubes lose elasticity, if the fluid becomes more viscous or its volume increases, the first problems appear at the extremities, farthest from the heart. The liver compromises this system in ways that are very specific and very documentable. It produces bile insufficiently, altering how your body processes and absorbs dietary fats. It mismanages blood proteins, particularly albumin, which is responsible for retaining fluids inside the vessels rather than letting them leak into surrounding tissues. It regulates hormones like estrogen imprecisely, and excess estrogen has a very direct effect on the walls of blood vessels. And it fails to detoxify correctly, leaving substances in the blood that damage nerves and vessel walls over time. All these effects manifest with visible signals that appear on the surface of the body. And the feet and lower legs, because of their distance from the heart and their dependence on strong, efficient circulation, are very often where these signals appear first. I want to tell you something that took me years of practice to fully appreciate. The body is always communicating. It never stops sending messages about what is happening internally. But most of those messages are subtle, and unless you know what you are looking for, you will look right at them and not understand what they mean. That is what today is about. Teaching you to read the messages your feet are already sending. Now the 7 signals. Look at your feet while I describe each one. Signal number 1. Red or reddish-brown spots on the calf and ankle. These spots have a very specific appearance that distinguishes them from ordinary bruises or rashes. They are small, ranging from the size of a pinprick to a few millimeters. They are distributed irregularly, not in a perfect pattern. Their color is typically red or rust brown. They are usually flat, though occasionally slightly raised, and they are found characteristically on the lower part of the leg, between the ankle and knee, most often concentrated on the inner side of the calf. If you are looking at your legs right now and recognizing this, pay attention to what I am about to explain. The mechanism behind these spots involves two things happening simultaneously. First, the venous circulation in the lower legs becomes compromised. Second, the walls of the small capillaries become more fragile and permeable than normal. When capillary walls are compromised, red blood cells begin leaking out of the tiny vessels into the surrounding tissue. Once outside the vessels, these red blood cells break down. The hemoglobin they contain transforms into a compound called hemosiderin, which is a brownish, iron-containing pigment. This hemosiderin accumulates in the subcutaneous tissue and creates those characteristic brownish spots that do not fade the way a normal bruise does. The liver connection is this. The liver produces a series of proteins that maintain the structural integrity of blood vessel walls. These proteins are part of what keeps vessels elastic and intact and resistant to leakage. When the liver is functioning poorly, the production of these protective proteins decreases. Vessel walls become more fragile. Capillaries leak more easily. The spots appear. I want to share the story of one of my patients. I will call her Barbara. She was 65 years old, a retired schoolteacher from Atlanta, Georgia. She had been living with these brownish spots on her calves for nearly 4 years. She had seen a dermatologist who told her it was a venous issue and gave her compression stocking recommendations. She followed the advice. The spots stayed. She moved on and stopped worrying about them. Barbara came to my office for something entirely unrelated, a shoulder pain that had been bothering her. As I conducted my physical examination, I noticed the spots immediately and asked her about them. She brushed them off as her old venous problem. But something in the pattern of what I was seeing prompted me to order a complete liver panel as part of her workup. Her ALT was nearly 3 times the upper limit of normal. Her AST was elevated. Her gamma-GT was elevated. An abdominal ultrasound showed grade 2 fatty liver disease. Barbara's liver had been sending that message for 4 years through spots on her calves, and nobody had connected the two. We began addressing her fatty liver with dietary modifications, reduction of refined sugars, regular walking, and close monitoring. 18 months later, her liver enzymes had normalized, and the spots on her calves had faded significantly. The practical step. If you notice brownish spots on your calf or ankle that have persisted for weeks or months, ask your doctor to include liver enzymes in your next blood panel. ALT, AST, and GGT. It is a simple addition to any routine blood draw, and it can reveal something important. Signal number 2. Spider veins or pronounced varicose veins on the legs. Varicose veins are dilated, twisted, visibly bulging veins that appear under the skin when the valves inside those veins fail to close properly. Instead of moving blood efficiently upward toward the heart, the failing valves allow blood to pool and the veins to enlarge under the pressure. Spider veins are the smaller version of the same phenomenon. They are thin, like fine threads, red, blue, or violet in color, fanning out in patterns that resemble spider webs or the bare branches of a tree. Most people know that varicose veins are related to genetics, prolonged standing, and pregnancy. What most people do not know is that the liver plays a significant and underappreciated role in the development of varicose veins in older adults. Here is the hormonal mechanism. The liver is one of the primary organs responsible for metabolizing and clearing estrogen from the body. Estrogen circulates in the blood and must be processed and eliminated by the liver. When the liver is functioning poorly, this elimination is incomplete. Estrogen accumulates in the bloodstream at levels above normal, and excess estrogen has a very direct, very well documented effect on vein walls. Estrogen makes them more elastic and more distensible. In excessive amounts, this elasticity becomes weakness. The veins stretch. The valves fail to close properly. Blood pools. Varicosities develop. This is why some of the most effective natural approaches to managing varicose veins in people over 60 involve supporting liver function alongside traditional venous treatments. The liver is part of the equation. If you have varicose veins or spider veins that have been progressively worsening, and especially if the progression does not seem proportional to your activity level or other known risk factors, it is worth having a conversation with your doctor that includes a liver function evaluation. Signal number 3. Cracked heels and chronically dry, thickened skin on the feet. Look at your heels right now. Press your fingertip gently against the skin there. Is it smooth, with normal flexibility? Or is it dry, hard, almost leathery, with visible cracks that may sometimes bleed or cause discomfort when you walk? Cracked heels and chronically dry feet are so common that most people accept them as normal. They reach for a thick moisturizer and move on. But in many cases, the moisturizer helps only temporarily and the dryness keeps returning, because the problem is not in the skin itself, it is in what the skin is not receiving. The liver produces bile, and bile is not only a digestive fluid, it is the delivery system for fat-soluble nutrients. When the liver is functioning poorly and bile production decreases, the absorption of fat-soluble vitamins from the intestine decreases significantly. Vitamin A regulates the turnover of skin cells. Without adequate vitamin A, the skin renewal process slows. Old, dead cells accumulate on the surface. The skin becomes thick, rough, and loses its ability to retain moisture naturally. Vitamin E is the skin's primary fat-soluble antioxidant. It protects the structural integrity of skin cells. When vitamin E is insufficient, the skin loses suppleness and cracks more easily under the mechanical stress of walking and standing. Vitamin B3 deficiency, connected to poor liver utilization of niacin, historically causes dramatic skin changes, including thickening and cracking. There is something telling about where exactly this dry skin concentrates, not evenly over the whole body, but specifically at the heels and soles of the feet. These areas experience the greatest mechanical pressure and the greatest demand for cell renewal. They are the first places where a nutritional deficiency affecting skin integrity will become visibly evident. If your heels are chronically cracked despite regular moisturizing, and especially if you have tried multiple products without lasting improvement, ask your doctor to evaluate your liver function and fat-soluble vitamin levels in addition to the thyroid check that is commonly done for dry skin. Signal number 4. Itching on the soles of the feet or legs without visible skin lesions. This signal may be the most frustrating of the 7 because it is difficult to explain, difficult to demonstrate to a doctor, and very difficult to treat when its root cause is not understood. Persistent, often intense itching on the soles of the feet, the ankles or the lower legs, without any visible rash, without redness, without swelling, without identifiable skin lesions of any kind, is one of the most characteristic manifestations of liver distress. There are two distinct liver mechanisms that produce this itching. The first mechanism involves bile salts. When the liver is congested or the bile ducts are partially obstructed, bile salts back up into the bloodstream instead of flowing properly into the intestine. As their concentration in the blood rises, they begin depositing in peripheral tissues, including the skin. Bile salt crystals in the skin stimulate the nerve endings in a way that produces an intense, persistent itch. This bile salt itching has several characteristic features that help identify it. It occurs without visible skin changes. Scratching provides almost no relief. It is significantly worse at night. It tends to concentrate at the extremities, specifically the palms of the hands and soles of the feet. And it does not respond normally to antihistamines or topical cortisone creams. The second mechanism involves histamine. One of the liver's responsibilities is the breakdown and clearance of histamine from the bloodstream. When the liver is not clearing histamine efficiently, blood histamine levels rise. The skin becomes reactive. Itching develops without any external allergen. I had a patient, Margaret, 70 years old, from Nashville, Tennessee. She had been itching intensely on her feet and hands for nearly a year. She had seen a dermatologist who found nothing. She had tried multiple antihistamines, cortisone creams, antifungal preparations. Nothing worked. She was losing sleep over it. When I evaluated her, one detail jumped out immediately. The itching was worst at night, worst on the soles of her feet and palms of her hands, and completely absent on her trunk. This pattern is almost diagnostic of bile salt accumulation. Her bilirubin was at the upper limit of normal. Her GGT was elevated. Her ultrasound showed mild bile duct thickening consistent with early biliary congestion. Once we addressed the underlying liver issue, her itching improved dramatically within weeks. If you have itching on your feet or legs without an identifiable dermatological explanation, and especially if it fits this pattern, ask specifically for bilirubin, GGT, and a complete liver panel. Signal number 5. Hot feet or burning sensation in the feet, especially at night. A persistent sensation of heat or burning in the feet that appears particularly in the evening and at night, in the absence of an obvious neurological explanation, is one of the less recognized but quite telling signals of liver involvement. Most people who experience this are told it is poor circulation or peripheral neuropathy, or that it is simply the natural result of aging. These explanations are sometimes correct. But when diabetes and vascular disease have been adequately ruled out and the burning persists, the liver deserves consideration. The liver is the metabolic engine of the body. It runs hundreds of chemical reactions simultaneously, and all these reactions produce heat as a byproduct. Under normal conditions, this heat is continuously distributed and dispersed through the blood circulation. But when the liver is inflamed, overburdened, or functioning inefficiently, the heat it generates increases. And when peripheral circulation is also compromised, this excess heat cannot be efficiently redistributed. It accumulates where circulation is slowest, which is typically the feet. The second mechanism is metabolic. A compromised liver fails to clear certain toxic byproducts of normal metabolism from the bloodstream. These include various aldehydes and incompletely processed metabolic waste. When these substances circulate to the periphery, they can irritate peripheral nerve endings, producing the burning sensation many people with liver problems describe specifically at night. The characteristic timing is important. Worse at night, when the body is horizontal and when the liver is handling its peak metabolic load from the day's meals. If you have burning feet at night, not explained by diabetes or another confirmed condition, add a liver panel to your next blood work. Signal number 6. Pitting edema at the ankle and foot. Do this test right now if you can. Find the bony part of your ankle or the top of your foot. Press your thumb firmly into the skin and hold for 15 seconds. Then lift your thumb and observe. Does a visible indentation remain? And how long does it take for the skin to return to its normal position? If the pit persists for more than 10 seconds, you have what clinicians call pitting edema. Fluid has accumulated in the tissues. The pit forms because the excess fluid is displaced when you press, and it refills slowly as the fluid seeps back in. There are several causes of pitting edema, and not all are liver-related. Cardiac failure, kidney disease, and venous insufficiency are the most common and must always be ruled out. But the liver mechanism is distinct and important. The liver produces albumin, the most abundant protein in blood plasma. Albumin performs a critical function in fluid balance. It generates what physiologists call oncotic pressure, essentially the pulling force that keeps fluid inside the blood vessels. Albumin molecules stay inside the vessels and create this osmotic attraction for water. When the liver is damaged or diseased, albumin synthesis decreases. As serum albumin falls, the oncotic pressure inside the vessels decreases. The balance tips. Fluid leaks into the tissues. In the lower extremities, because gravity pulls fluid downward, this leakage is most visible as ankle and foot swelling. Liver-related pitting edema is typically symmetric, affecting both legs fairly equally. It is worse at the end of the day and better in the morning after lying flat. And it is often accompanied by a sense of abdominal fullness or bloating, because the same mechanism also allows fluid to accumulate in the abdominal cavity. If you have pitting edema of new onset, or that has been worsening, request an evaluation that includes serum albumin level alongside the usual cardiac and kidney assessments. Signal number 7. Fungal toenails, thickened nails, or whitish nail bed. Fungal nail infections are so common that they are often dismissed as purely cosmetic problems. But for people over 60, recurring or treatment-resistant nail fungus can be an important signal worth investigating. People with liver dysfunction are significantly more prone to fungal infections throughout the body, and there is a clear biological reason for this. The liver is central to immune function in ways most people do not appreciate. It produces many proteins of the complement system, which are early responders that identify and attack invaders like fungi. It produces acute phase proteins that coordinate the inflammatory response. It processes toxins that would otherwise suppress immune activity. And it helps maintain the gut microbiome, which is the first line of defense against opportunistic organisms. When the liver is compromised, all of these immune functions weaken. The gut microbiome shifts unfavorably, with beneficial bacteria declining and fungi like Candida becoming more prevalent. This imbalance reflects throughout the body. The skin and nails become more hospitable to fungal growth. This is why treating fungal nail infections in someone with unrecognized liver disease is so often ineffective. The antifungal medication suppresses the infection temporarily, but the underlying immune dysfunction persists. The fungus returns. The cycle repeats. If you have had recurring fungal toenail infections that keep coming back despite treatment, especially accompanied by other signals from this list, ask your doctor to evaluate your liver function. The second nail signal worth noting is the whitish nail bed. Under normal circumstances, the nail bed appears pink because blood is visible through the translucent nail. When circulation to the toes is compromised, as it frequently is in people with liver problems, this pink color fades and the nail bed becomes white or pale. Nails that have become mostly white, when no injury explains the change, are a documented clinical finding associated with chronic liver disease. Even in milder dysfunction, partial whitening can be an early indicator worth investigating. What to do with these signals? You have now seen 7 signals. Brownish spots on the lower legs, varicose or spider veins, cracked heels and dry, thick skin, itching without visible skin lesions, hot feet or nighttime burning, pitting edema, fungal or whitish nails. The tests that give the most information are simple and inexpensive. ALT and AST are the liver enzymes that rise when liver cells are under stress. GGT is particularly sensitive to fatty liver disease and bile duct problems. Serum albumin reflects the liver's protein synthesis capacity. Bilirubin reflects the liver's ability to process waste. And an abdominal ultrasound provides a direct visual assessment of the liver's size and texture. These tests can be ordered as part of a standard comprehensive metabolic panel and are available at any laboratory. I want to close with something I have learned from 3 decades of practice. The liver is one of the most resilient organs in the human body. It has an extraordinary capacity for regeneration. Damage that in other organs would be permanent can be reversed in the liver when the underlying cause is identified and addressed in time. People with early fatty liver disease who make targeted lifestyle changes can see complete normalization of liver function. The window for effective intervention is real and meaningful. But this resilience has a cost. The liver's willingness to compensate and keep working without obvious complaints means that problems can progress quietly for years before becoming apparent through conventional channels. The signals I showed you today are the liver's way of communicating through the body's periphery when it has not yet reached the point of obvious symptoms. They are early messages, whispers, not shouts. You know how to hear them now. Tell me in the comments, did you recognize one of these signals when you looked at your feet just now? Write the number. I read every comment. If this video opened your eyes, share it with someone you care about. With a parent who always has swollen ankles. With a friend who has had nail fungus for years and cannot get rid of it. One share can make a real difference. And if you have not subscribed yet, please do that now and turn on notifications. Every week, content like this. Honest, practical, and science-based. Take care of yourself. I'll see you in the next one.